of us with the coffee today, Julia.
Gussie, everyone wants to
Hi,
see you before we
Gussie.
start. Hello. That's the thing about dogs. You could just make them so goofy. Right, Gussie? Here, have some coffee. There we go. Do you realize we're drinking from the same cup? Gussie, you're a good girl. Right?
Ah, Jen's got her pug too. Great.
Oh, that's right. Jen has a pug. I remember that.
Mm.
Good girl. Okay.
Mhm. All right, so we're right at 1 o'clock. Let's get started. So I'm going to give
Okay.
everyone a minute to just finish up any poll voting. So we've got a lot of people here who are curious about animal-assisted therapy. Stephanie's welcoming everyone in chat. Thank you, Stephanie. And we've
Mhm.
got Philadelphia, Greenwood Lake, Manhattan, San Diego, and this very building, School of Social Work represented here.
Hmm.
All right, so I'm going to end these polls and take us over to a quick intro to Adobe Connect. My name's Mattia Marquardt. I'm the Associate Director for the online campus. And I'm just going to do a quick run through on Adobe Connect, just in case there's people here who are new. So if you start experiencing issues and you're on Google Chrome, you might need to log out and come back in with some other browser, which you can just X out. We get this question a lot. How do I get out of here? Just X out your browser. Feel free to type all throughout the this webinar because we want it to be a conversation. And you guys are doing great at this, so I really appreciate that. If you need to make your chat size larger, you can do that by clicking here on this the menu option, and then you can change your text size to whatever you'd like. To respond to a poll, just click on the boxes or type in the space and then click the enter, which you guys, a lot of you have already done, which we appreciate. And you'll be able to tell you responded because the box there'll be a check mark or a circle, or it'll say answer submitted. And with that, I'd like to introduce Amy Werman, who is one of our fabulous lecturers for both our residential and our online campuses. And she's also a family therapist. She has a DSW, and she's going to give us a wonderful introduction to animal-assisted therapy. Thank you and welcome.
Thank you very much, and thank you all for joining me. This is definitely a topic that is true to my heart, as you can see. Um, Matei, are you going to ask me questions, or should I go through the slides? What's preferable for you?
Well, I'd love it if you could tell us a little bit about what is animal-assisted therapy, first of all.
Okay, so in that case, I'll let my slides guide me. And so, animal assisted therapy is one intervention of a group of interventions called animal assisted interventions. What's unique about animal assisted therapy, what distinguishes it as therapy, is that there's usually a professional, some kind of degree professional with the dog, and the other thing is that it's very purposeful. There are therapeutic goals. So if I were just doing animal assisted activities, and I have done that, I will take Gussie to a nursing home or to any kind of venue, and she'll just be pet. People will walk up and pet her and that kind of thing, but there's no specific goal. When I have Gussie in my private practice, sometimes it's to get a child to sort of open up and start talking and sort of like getting into deeper content. So, animal assisted therapy is more goal oriented. And the last category is assistance animals, which are service dogs. You've seen them, they help people with medical conditions and emotional issues, um, and they really perform tasks for the person.
Hmm.
Okay.
Thank you.
All
So I
right.
think we have a poll next for everybody. I'm going to bring
We
up our
do.
first poll.
Everybody, please weigh in.
Hmm. It's going very fast. Love it.
Mm.
All right. All of the above is sort of inching out the other. It's interesting because people are voting from the top and then they get to the bottom and they're like, oh, that one.
Right. But I can't believe everyone is wrong.
You got us.
Um,
What's the answer? I'm going to end the
okay.
poll and take us back to the slides.
The answer actually is all of the above. It's all of the above. Um, One of the things about dog assisted therapy and using dogs in particular, the literature has actually teased out dogs from other animals, and dogs seem to really be able to bestow certain benefits on different populations, whether it's age or presenting problem. And some of the problems that dogs are very effective with are the ones listed below. Okay, so dogs have been shown, animal assisted therapy with dogs has been shown to confer, lots of advantages in these problems.
Hmm.
All right.
So how did you and Gussie get into animal-assisted therapy?
Well, it's funny you should ask. I happen to have the slide to explain that. And uh, so I have always loved dogs. When I was a girl, I had a little West Highland White Terrier. Then, when I became an adult, I had a black lab, and she was an amazing dog. They're very trainable. And eventually, I got pugs. When I moved into the city, just a pug takes up less space. So, my love of dogs, and I've also loved clinical practice. I have a private practice, and I found that when the dog was in the practice in my office, something very sort of magical happens, and I would also say mysterious. Just anecdotally, I can tell you that when one of my clients would start to get emotional in the session, somehow she picked up on that and she would go over to them and just sit by them on the couch. So it's almost like something intuitive goes on with the dog. So I felt that I really wanted Gussie to get that credential, really to have her really involved in the process therapeutically. So I took her to get training, and myself as well. You don't just get the dog trained, you get yourself trained. The other thing is, and I was telling this to Matea yesterday, that growing up, my parents expected their children to be to give back to the community, and I continue that tradition with my kids, and I also insist upon it with my dogs. So Gussie is giving back to the community.
Very nice. And what did the training entail? How did you get into this together?
So the way that works is that there are certain organizations in the community that are nationally, actually. One of them, the big overarching organization is Delta Society. And then there are little umbrella, little, I guess, other organizations that do the certification or the licensing. And one of them is Pet Partners. So I got in touch with Pet Partners and we found a facility near us. It was actually a bite-a-week, and they offer the course. So the first thing that happens is you take your dog to the handlers, and they have to temperament test the dog to make sure this dog has the right attitude, all the right features that would make her a good therapy dog. Um, if the dog passes the temperament testing, then the trainer or the handler, myself, is supposed to take an online course. So there's sort of a didactic piece to the training. After that, you enroll in the training course, and that's the owner and the dog. And it's about an 8-week course, once a week. You have to show up with your dog, and you do a whole bunch of exercises each week, besides the basic commands like sitting, come, leave it, if you don't want the dog to touch something. Um, the, the course facilitators really do things like they try to simulate different situations. For instance, if Gussie was at a hospital, they'd sort of roll walkers right by Gussie. They'd try to shock her with real situations, like a medical code going off, to make sure she would be okay. And she was. She was really okay with that. Um, I will tell you that of like the 8 dogs that started, we were sort of whittled down to 6 because 2 of the dogs just couldn't hack it. They started to get really like overstimulated by the training. Um, so anyways, then Gussie got licensed. She takes a test at the end, and she gets graded, and I get graded as well. And I will share that when she was recently relicensed, which is the same test, Gussie got an A and I got a B.
She's
I
very
was
smart.
really, she's very smart, and I was uptight about just making sure she got through it. She was chill, and I was like really anxious. So she did show me up.
So
So
what does
that's
your
that.
license look like?
My license, which is issued by Pet Partners, looks like you can see it right here. And
Hmm.
the little license on top on the left, that little round circle, goes on Gussie's leash. And I put that on her whenever we're going to some kind of gig. Okay, so we both
Mm.
have to wear our tags.
So Sophie is wondering, is there a kind of dog that's best for therapy training?
That's a great question. If you would ask me when I had my first pug, I would say not a pug because they're usually, and I'm generalizing, but the breed is usually very hyper and a little bit wild and, maybe a little bit overwhelming for the types of populations that we see. But meanwhile, Gussie is a terrific therapy dog. Just, I would say, any dog with a good temperament that really loves people and doesn't mind being pet all over. Um, any dog can be a therapy dog. When Gussie and I took the class, we had a whole mix of dogs in the class. So really,
Hmm.
any dog would qualify.
And what kind of work do you do together?
So Gussie and I predominantly go to, um, we go to college campuses. I always bring Gussie during the semester to Columbia, wherever I teach. And if you see this slide on the right, we are at CCNY, which is City College of New York. We were actually visiting the medical campus. This is another woman who also was um, volunteering that day. And what happens is when we go there, they usually give us a station and people just randomly come up, the students, and will pet the dog, sort of like a de-stress. But as you can see on the left, Gussie is a regular at my private practice. And sometimes she even lets me sit in my chair.
So,
So,
can you
as
tell
you
us a
can,
little bit about?
yeah,
Oh,
go
sorry.
ahead.
Can you tell us a little bit about the research on animal-assisted therapy?
So this is very interesting. It turns out that it is not the most well-studied, uh, area. I would actually say that there's a paucity of literature. Now, even though there are studies that are written, the issue is that many of the studies are not rigorous, meaning that they have not had a control group. Some of them have not even had a comparison group. But the studies that I will put on the final slide for reference, they are good studies, and I actually use them in my research methodology class. But the research does show, okay, that at least for most of animal assisted therapy, and
Wait, don't give us the
specifically,
answer though,
oh,
because we're gonna do
oh,
the prediction.
okay, but just in general, animal
Hmm.
assisted therapy has been shown to be effective with a whole bunch of populations and in a whole bunch of different venues, whether it's in a residential place or a college or even dogs assisting children in reading programs in libraries.
Hmm.
And I would also add to that occupational therapists and physical therapists use dogs as well.
Mm.
Okay, so one particular study that I love to present to my research students was a study done with a real live dog and a mechanical dog. All right. And the question was, does it really matter if you're using a, a real dog or a mechanical dog in terms of reducing loneliness in long-term residential patients? So this particular study looked at 3 different residential care facilities with elderly clients, and one group got a real live dog, and another group got Abo, the mechanical dog. And they wanted to see if there was a significant difference in each of these treatments. And so I would ask our viewers to weigh in on this, to make a prediction.
All right, and while people are voting, I'm going to turn down my microphone volume a little bit to make it a little bit more even.
Okay.
All right. Okay, so people are thinking.
Okay. So we're asking you your prediction. Who do you think is more effective? A dog like Gussie or a mechanical dog? Like a little robot dog?
Nobody thinks robot dogs help people more. All right, I think most people have voted, so I'm going to end the poll and I'll let us know what the answer is.
Okay. So shockingly enough, the answer is in this particular study, okay, it turns out that the mechanical dog and the real dog, okay, had the same effect. They were both effective in reducing loneliness. There was not a significant difference between the two groups. And I know this probably defies everything we believe and feel intuitively, but it was actually in this particular study the finding that there was no difference.
Hmm. So I'm surprised nobody's in chat saying what? Because that to me is very surprising. So robot dogs and real dogs in these long-term residential care facilities had about the same impact on loneliness.
They had about the same impact, and there are some theories as to why that was.
Well,
So
that's good
I
because
will tell you,
Stephanie's asking.
okay.
Hmm.
So one of the theories is that if you think about it, for both conditions, a human has to bring the dog or the robot in to see the person. So in that respect, they're getting human contact right there.
Mm.
Okay? Um, and another theory is just that, you know, even even if it's not a real dog, it does have something that it does. You know, it does act and sort of interact. And even though it's not warm and furry, it does, it still interacts with the person and breaks up their day a little bit. So
Mm.
those were some of the explanations. Of course, this invites further research to understand really the mechanism. See, that's what is unknown about animal therapy. We know that it's effective in doing all the things that I said before, in helping kids with social skills, in helping medical patients reduce hypertension, but we don't know what's called the black box in the middle of the intervention and the result. We don't know what the mechanism is that is causing the change. And that
Mm.
is where the research is going right now, trying to figure out what is it about, dogs and animals that makes that change.
Hmm. So Catherine's asking, were there differences in other outcomes in this study?
That was really the major outcome of the study. Okay, looking at the reduction in loneliness.
Hmm. And Margaret's asking, do you think the robots can respond to the emotions in the room, which is something that dogs can do even without being cued?
I don't believe so. I don't think that I think basically this robot was sort of like something that just maybe barked and moved a little, but other than that, other than acting physically, I don't think it had any other capacity.
Mm.
Oh,
So we've got some votes to
okay,
see
let me
Gussie
get
again.
Gussie. Gussie, Gussie, come, cutie, come on. You have
And
to
while
look.
that's going on, Jen is asking, was the study published? So I'm just going to bring up the references.
Yes, this particular study is the bank study. Okay. Right, Gussie?
I'm going to make this a little bit bigger. There we go. Gussie is getting some compliments. Catherine says
Aw,
Gussie's very cute.
don't look at me.
Mary Lay is asking, how could anybody prefer Ibo to Gussie? It makes no sense.
I agree. I don't know that they did that experiment with pugs, which is interesting. Maybe a variable is what kind of dog they're using.
Hmm.
I don't know.
So, someone was asking, Catherine was asking, can you talk more about what Gussie does during the psychotherapy sessions?
Sure. So, um, you know, it's sort of very unstructured, to be honest. I mean, what I have her do is just be present in the room. And if the patient wants to pet her or something or interact with her, that's that's perfectly fine. I don't force her on them. I don't do anything to sort of facilitate that interaction. It usually happens sort of organically. Either Gussie will go over to the client, or, the client will start petting Gussie. And I can tell you one particular instance. I had a young girl, maybe about 10 years old, who just would not open up in therapy. She didn't want to talk. I couldn't engage her. I really tried hard. And then one day, with her permission, I brought Gussie into the room, and she just started petting Gussie, and you could see like her emotions come through, and she started talking. So I
Hmm.
think that the the presence of Gussie um, really just helped her feel comfortable.
Hmm. So Catherine's asking, do you ask each client if they want Gussie in the room during therapy or not? Or how do you decide?
That's absolutely the case. I mean, I always tell a new client, first of all, a new client, I'll say, look, I also have a pug, and I can bring her into treatment if you like dogs. Um, and so I always ask at the beginning, but I don't have Gussie in for every session. Okay. And that's sort of like you do that by feel, because if it's very sort of intuitive, but if I'm working on something and I feel that Gussie would perhaps be more of a distraction, then I will take her out of the room or not include her in the therapy. But, otherwise, I asked, would you like Gussie to come into the room today?
Hmm. Kate has a question. Is Gussie covered under your liability insurance? My dog is a certified therapy dog, but only covered by a certification when I volunteer.
Yes, that's exactly that's the same for me. She's covered by the certification by Pet Partners.
Hmm. And there's
Hmm.
some more questions coming in. Jen's wondering if she gets to meet Gussie at graduation.
At graduation, well, the truth is we're working on a hat with a tassel for her right now and a little gown. So if we can pull that together, she'll be there. Well, and I will say that she attended the NASW conference last week.
Oh, she did.
Yeah.
Very nice. So Jan is wondering what kind of training Gussie received, which we sort of covered at the beginning. But is there anything you wanted to add to that?
Other than really the sessions with Bidaway and their instructors training us, I just have to emphasize that it's not like you just take your dog. In fact, when my experiences, even before I got into pet therapy and I wanted to train my dogs, obedience train them, it was always the owner that got trained on how to handle the dog. So we got trained for 8 sessions through Vitally.
Mm. Sophie's wondering what age are most dogs certified?
Oh wow! I mean, I don't even. That's a great question. I would really say that it's probably after. Um, I'd probably say after their puppyhood, like their
Mm.
you can train a lot of dogs at like 5 months and on because they have the concentration or the attention. So I guess any time after that, you can hold their attention and they can really understand the commands and um, I guess not freak out by external stimuli. I don't know that there's really an age on it. I'm not aware of that.
Mm. Catherine wonders what you think about using cats in therapy sessions.
I don't see why not. I I know that you can, certainly certify cats as therapy animals.
Hmm.
So I'm sure, and I am also sure that there's literature on it.
So we're down to our last minute. I'm just gonna make this a little bit bigger. So if anyone has further questions in the future, um, they've got your email here. And I want to plug our future events because this group has been so amazing, and I hope that you'll continue to come to our events. And I think we have time to squeeze in another question or two. So Alina's has
Let's
a
go.
client who was gifted. I know. Yeah. Alina has a client who was gifted a service dog by a nonprofit, but the dog was not properly trained. Do you know of any organizations that can train a dog to be certified?
To train a dog to be certified, um, I think that it would require her to go with the dog to get some kind of training or to do, there's a lot of places that just do obedience training, and that's a start. To
Mm,
correct the training, that's, yeah, I, I don't know why the dog wasn't properly trained, but you can do it privately with an obedience trainer, or you can go to look, ask the Delta Society. Okay, the Delta Society can probably point you in the right direction.
thank you. And then I'm just going to squeeze in the final question. Can you recommend any particular source for animal-assisted therapy training for humans?
Any particular source?
Hmm.
Again, I would say I would go through the Delta Society
Hmm.
and see what they offer. Actually, I don't know that Delta Society certifies anything but dogs, but I guess, dare I say it, the best thing to probably do is a Google search.
Thank
Yeah.
you. All right, so we've hit our time limit, and I just want to thank Dr. Werman for spending her time with us today and volunteering to put together this presentation and share Gussie with us. Maybe Gussie can wave goodbye. And I want to thank everybody
Gussie.
who's here. Thanks so much for taking the time to join us. We have a final, if you care to share how you heard about our online campus, we've got a final poll here. And
And
Gussie is going to
Matea,
wave us
I
out.
would also, I just want to thank everyone. You've been a great group of participants, and please feel free to reach out to me. Okay, all the information is there.
Mhm.
Or Gussie.
Same address. Thank you, everybody.
Okay.
No, Gussie. Bye, Gussie. Mary Leah loves his paw wave.
Uh,
Thank you, everybody. Oh, Sandra's asking, can we get handouts? Well, when we send the recording out, that we are actually our handouts weren't super, our slides weren't super substantive. So,
mm,
yeah,
they were
maybe I'll
like
just,
prompts.
yeah, I'll, I will copy paste into chat the resources slide. So there's that. And then there's a few journal articles, which I'm going to paste in one by one. And then, yes, we will have the recording available on our YouTube channel. And that's the last one. Yep. And Janine is typing something.
Mm-hmm.
Great. Thank you, Sandra. Yeah, Janine, the resources on this last slide, if you want to just copy paste it from the chat right above. And then they'll be in the, oh, sorry, the ones on this slide that we're looking at right now. Gotcha. Okay. Thank you for asking, actually. So I'm going to type those into chat also. Um, and our future online events, let's see. That didn't come out very well, but then these web links should work pretty well. There we go. All right. Thanks, Janine. Great. And thank you, Stephanie. Yes, please feel free to contact Stephanie if you have any questions about our online campus. She is amazing. All right, so with that, I'm going to end the recording and say thanks, everybody.